That is such a good observation and so true. Mom's actually getting past that, but especially when she was mobile, they are like children, just like children. If they see it, it's theirs. If it's in your hand and they want it, they're going to take it. So similar to children. And you know, with all the accidents and things that happened to Mom, bathroom accidents, she never was even remotely embarrassed because all that was gone. So yeah, like that is exactly what it is. It's exactly what it's like. And speaking with hospice, they even said that with Alzheimer's, you go from child to adult back to child. And it's very accurate. When Mom had her stroke, I had a hard time dealing with that. But the minute Mom flipped into dementia, it was like I knew exactly what to do and how to manage her. So it's a childlike thing. And as a mom of 3, it just kind of came right back to me. So yeah, you're right. Okay. This is good. Like, this is the conversation I want to have. And I'm not saying I have an answer for this dilemma, but what the heck? Like, if she refuses to have her teeth brushed, what do we do? Like, how do you handle that? I know if we go back to talking about the comparison of dementia and toddlers, you know, there are times where you have to do what's best for a toddler, even if they're kicking and screaming. And for the most part, most people understand that. It's those things that have to do with their health, life and death, you know, extremely dangerous things. Like, you have to draw a line somewhere and you have to force them, even if they're kicking and screaming, to do what you want your child to do. Okay, dementia. So what do we do? Like, they no longer have an understanding of what they truly want, don't need, what is essential for them. They have absolutely no understanding of those things. So how do we fix that? How do we go from trying to respect them and give them dignity, which again, it's weird, but I have issue with that. At this point of life for my mom, dignity is not a thing she cares about. She just doesn't. Nothing bothers her anymore. This woman has gone to the bathroom in her hand and showed it to me, just like a child would, just like a toddler would. Where's the dignity in that? So when we give so much weight to making sure that their rights are there and making sure that we treat them with dignity, I don't think that serves the greater good. I think we can respect them where they are. And I try to do that. I think you see that in my videos. My goal is to respect Mom where she's at. And really, really try to get her to do the things she needs to do. There is some fear. There's some fear that it would be really, really easy the minute she refuses to just check off, she refused, don't have to do it anymore. Try tomorrow. Oh, she refused again, not going to do it again this day. Same thing with therapy. Like, Mom refused therapy, so they quit therapy with Mom. You know, Mom's refusing having her teeth brushed, so they're not brushing her teeth. They didn't even know where her toothbrush was. No idea. They had to get me a new toothbrush and toothpaste. How long? When did they quit? You can't even ask her every day if you don't have a toothbrush for her. So yeah, those are some of the issues that I have with the whole, if they refuse, it's not done. I can't tell you I know the answers. And no, to answer your question, I don't think that, you know, you headlock them and brush their teeth. That would be completely traumatic. And you all have seen that I always opt in not trying to traumatize mom on things that I think are trivial. I just don't know that I think brushing her teeth is trivial. I think that's more important. Honestly, I don't care about brushing her hair, because that to me, it's something that we need, that makes us feel good to see her hair be brushed. It is an indication of care. I get you there. But it is not crucial to her health, to her pain level. A toothache's going to hurt. An abscess or an infection in her tooth is going to be an issue. So yeah, I kind of would like to see some solution to mom not wanting her teeth brushed. But no, I guess nobody wants abuse. I do find that abuse is different for different people. I don't know. I really don't know. I'm glad you came in. I'm glad you asked that question, because it's a very good point. And everybody's going to be different on that, loved ones, staff, everybody's level of what is too much is different. So I don't guess I have an answer. But yeah, this whole they have a right thing, I don't know that I think that's the accurate approach. What's the better approach? I don't know. But that they have a right to refuse when they just don't have a brain that functions anymore. This isn't the solution. So I guess we're still searching for a solution. What are your thoughts? Gosh, Barbara, I wish that it was that easy. I wish I could just load mom up, pack her stuff, drive her to another nursing home, and we'd be done. She'd be in a new place. That is not how it works. Mom has to be in a locked unit. She needs to be in the memory care ward. And those are harder to come by. Not every nursing home has that locked unit. And the ones that do, it's always smaller. It's nowhere near as big as the actual nursing home. And it is normally full. When they have an opening, the first option goes to a resident there. So if they've got a resident that needs to go into memory care, they're going to get that bed first. Lastly, nursing homes only have so many Medicaid beds, and my mom is on Medicaid. So, for instance, we tried to get mom transferred to a nursing home near dad months ago, maybe a year ago, and she was denied. Because of dad being so sick, I have asked them again to look into transferring mom to this nursing home. It's under the same umbrella as the nursing home she's at now, and it's near dad. So I've asked again. I've already heard back. They have no bed in the locked unit. So, two things. One, I know that they are talking to everybody that works with mom, nurses, I guess, and the doctor and everything, to see if they think mom is still considered in need of being in a locked unit. Depending on that answer, we may be able to get her transferred sooner, but there's no opening at all right now at that particular nursing home. And the one bed they had, the one Medicaid bed they had, was actually filled the day after I asked for the transfer. So I don't know what that means. I don't know when another Medicaid bed opens up. Mom's on the list, that's all I know. Because of dad's situation, I will be actively pursuing getting mom closer to dad, and if that means going outside of the umbrella of this nursing home, then that's what I'll do. That's my priority right now, is dad, so that he doesn't have to travel so far. But yeah, so as you see, the obstacles are there. This is not This is not as easy as just getting her out of there. I wish it was, but it's not. I see a lot, not a majority, but you know, a lot of people who will come on here and just say, take her home, get her out of there. You know, if you feel the need to say it, I guess say it, but it's not helpful. And there's answers to why that's not possible. But I get that you hate seeing her there, and I do too. So yeah, you know. You know, short of 24-hour care, how do they keep it where they're always pristinely comfortable, never tilted, never sleeping in an odd position? It is never fun to walk in and see that mom is in an awkward position or tilted all the way to the side. No, I don't love that. I cannot automatically assume that she's been neglected. There's a couple of things that could be happening there. She could have just tilted over, maybe. I mean, I sit with her all the time. Just in my short visits, you can watch her going from sitting up to tilting over. So yeah, what are they supposed to do? Two, if she seems to be comfortable, if she's not complaining, why on earth would you move her because you don't think she's comfortable? You know, it's the old, what's the old thing? Like you're cold, so you put a sweater on your child. And if you're like me, my temperature gauge is not like anybody else in my home. But because we look at mom and we say, oh, she must not be comfortable, doesn't necessarily mean she's not comfortable. So short of having someone sit there and literally stare at her and then agitate her to make her upright and perfect, I just don't, you know, I mean, I'm glad wherever you are, everybody's laying in bed correctly, but I don't have much to say here, you know? The bed sores. She does not have bed sores. There have been times where I have talked about it and maybe didn't know, but right now I do know she does not have bed sores. And I have asked for the inflatable bed, and I'll find out at the care plan meeting what's being done about that. So, hey. I have a quick question and an update. So, update. The nursing home near Dad that is under the umbrella of the nursing home Mom is at does not have a bed in the memory care unit. They did have a bed outside of the memory care unit, but it was filled the day after I actually requested the transfer. And it was a Medicaid patient, and they only have so many Medicaid beds. And so that was their last Medicaid bed that they could fill, I guess, at this time. I don't understand how that works. If anybody understands how that works, please let me know. So here's my question. If they were to decide that Mom no longer needs to be in a locked unit because she's not a flight risk, because she's not mobile anymore, how does that change her care? Is care different outside of that locked unit, considering that Mom's dementia is so far advanced she doesn't know how to ask for what she needs? I just want to make sure if they come to me and say that they've decided that Mom qualifies to be outside of the memory care ward and can be in a regular bed in the nursing home, is that a good move for Mom? So if you guys could help me, if you know anything about the differences in care for someone outside of the memory care ward and care for somebody in it and how that compares, and what you think as far as Mom, I really would appreciate that. After I talk to them on Wednesday, if it looks like it would be quite some time before they would have a bed for Mom at their nursing home that's closer to Dad, then I am going to begin to look around Dad and see if I can get Mom closer to him. So I'll keep you posted. Thanks for all the info. It is stormy here today, and so I decided to do a good many response videos, and because of that I changed my shirt every single time, so if you need to go back, it'll look at least a little different. But this is not helpful. I don't know if you guys say it to be helpful. I don't know if you say it to be hurtful. I don't know if you say it because you care for my mom. But it isn't helpful. And so I don't understand that at all. But on the flip side, I see hospice tomorrow, and we sign the papers to get hospice going for Mom, which I am very hopeful will be good for her and a great assistance for me and for Dad. The very next day is the care plan meeting. I am very excited about that, and I am getting a long list thanks to you guys coming in on that other video and giving me tips and things to talk about and add to my list. So I appreciate you guys so much. Thank you. But yeah, these I had a good handful of those. I try to think that maybe you guys just love Mom so much that this is your contribution to the conversation. But yeah, it's not helpful at all. There's nothing I can do with that at all. There's so many reasons why I can't make that happen. And if you know from me from the beginning, you know why I can't make that happen. If you know my dad and the story of my dad and my mom, you know why that can't happen. I'm doing the best I can, and trying to make the best decisions for Mom and Dad, and even myself, with this awful situation that we are faced with living and walking through. So, be nicer.